बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि व सल्लि अलैहि. Dear colleague, this is male young patient, almost 30 year age, with history of pain and tenderness at the right iliac fossa region. So suspecting appendicitis, I am directly using the high frequency linear probe and scanning the right iliac fossa region. So this is the right iliac fossa region, and here we can appreciate this lymph node. Usually such lymph nodes are not present at the right iliac fossa. When such lymph nodes are present, it means that there is some inflammatory process at this region. This is another lymph node. These are the mesenteric vessel. This is another lymph node. And look here, this is the gut loop, which is edematous. I am going to press it. We can appreciate that this gut loop is compressed. So this is the distal ileum, part of the distal ileum. And posterior to it, this one arising from the same gut loop. This is above and anterior, and this one is below and posterior to this gut loop. So this is the terminal ileum, and this is the appendix. We can clearly see this is the base of appendix originating from the cecum at its posteromedial aspect, and above anteromedial, above it, superior to and anterior to this appendix, base of appendix, this terminal ileum is originating. This is compressed when we apply the probe pressure, and this is not compressed, and this is deeply situated than this ileum, distal ileum. Now I am going to follow this. Here we can appreciate this is the fluid with internal echoes, and this is the tip of the appendix. Okay. And here this whitish tissue which is wrapping around the appendix, it is the mesoappendix. Mesoappendix means the fold of peritoneum. And now look at here, this is the periappendicular fat, which is more echogenic than the normal. So when such condition is present in this fat, it means that fat is also inflamed. It is showing inflammation. And here is the tip of the appendix. So I am now going to see the vascular supply of the appendix. What is the condition of the vascular supply? The appendix is supplied by the appendicular artery, which is the terminal artery, and does not have any terminal branches. This is the terminal artery. That is again the branch of ileocholic artery, and ileocholic artery is the branch of superior mesenteric artery. So let's see what is the behavior of how appendicular artery behave in the appendicitis. Let's see. We can see the pulsating artery appendicular artery is present in the mesoappendix. So if we closely observe, we can see that the sharp peak systolic velocity and the diastolic flow is very much low. It means that higher resistance to this flow is present. If we see the RI of this appendicular artery, it is 0.87. So the RI is 0.87 while the PI is 4. So it means that the Doppler indices are increased during the appendicitis. Normal it is less than 0.7 RI should be. It is 0.87. So we can appreciate that during the appendicitis, due to the edema, inflammation, there is a greater resistance to this flow of the appendicular artery, resulting in the increased Doppler indices. If it going on and the resistance is gradually increasing, one time will come when the appendicular artery may show reverse flow and then thrombosis. When such occur, then the gangrene of the appendix may occur. So still there is high resistance flow but no thrombosis is seen. It means that there is an active inflammation that is going on and the appendicular artery is facing high resistance. So this was, in conclusion, we can say that this is the case of acute appendicitis with high resistance to the appendicular artery surrounding by the inflamed periappendiceal fat and mild amount of fluid which contain the internal echoes. So this was all about the appendicitis. Thank you very much.